You okay over there?
Mm-hmm.
It's a cover, just an illusion. Good morning, 747. Let's get right to it and get the medical director for public health on the line, Dr. Janna Manglona. Good morning, Doc.
Morning. Who is that music? I love it.
That's KFC Kids from Chuk doing a cover of Just an Illusion. It is really good, Jam.
Oh my gosh. That's all right in there, me possum.
Exactly what I said. Amen. Sticky stickum.
Isn't that right, Richie?
Oh, wow.
Okay, I'll leave you alone.
Right on.
Okay, let's get to it.
Let's get to it. Everyone's
So
talking about.
We've got some new cases.
Yeah, this is what we want. So, what can you tell us about
Army?
the Army or whatever? It's Air Force.
Air Force.
Oh,
Is it Army?
There you go. There you go.
So, just start at the beginning. Doc, we had, was it 7 positives?
7, but I think 4 are part of the count, and then 3, I think or 3 they're waiting for the official notification.
This is where you don't want to compare reports, because if you pull up 8 hours ago, it was 2, and if you pull up yesterday it was 7. It's not a problem, but there's a little bit of a delay when it comes to the military, because where they send the bases, what bases they send it to get it tested, and sometimes there's a little jet lag there. And so where we get our same day or the next day, we are lucky, because on the mainland, people are waiting 3 to 5 days for their results at a minimum. And here we use the same equipment they have at New York University, and we've got the good stuff. And we can give same day. If you want it same day, you can have it. If you want it in 45 minutes, you can have it. But we tend to batch them. But if there's an urgent case, we just push it forward. So we're really fortunate here. So because the numbers are sort of up in the air. Even we were like, is it 2? Is it 7? And how many contacts? This sort of thing. So it looks like, as of, let's see, which report did I print? This one is from Pacific Daily News, and they do show that there are 7 now. So I imagine that 3 more trickled in since last evening as being positive.
We just had a hard time. I mean, Nestor Lecanto did the story for us yesterday, and it was just really hard to pin down any kind of comment for the military. That being said, Doc, does public health have the authority to go in and do the contact tracing inside the base? So how does that whole process work?
I'll tell you what we do.
Okay.
We are public health. It's so funny because you and I never even spoke before all this came up. It's just, everything is just changing as we go along now, and what we do, and we've always been in the background doing our work, but it wasn't as public. What we have is a SWAT team, and police have one, we have one. If there's a bug loose, we go for it. And whoever you are, whatever group you're with, if you're with the military or you're just one of our community, if we hear there's a bug out there, we dispatch our SWAT team, and we say, do you need us? We'll be glad to come on base. We'll be glad to do off base. And with the military, they tend to say, we'll take care of ours on base, or like with the Teddy Roosevelt. I mean, right. they had their whole enchilada and their game face on. So, and there were staggering numbers, and so they were like, we got this. And we're like, okay. So we just back off. We are there. If you need us, we're standing there twiddling our thumbs going, tell us where to go and when. We're there. And so that's how we work with them. We work collaboratively with anyone, any group that comes in that brings anything with them, whether it's Shigella, dinghy, whatever it is. And we just go out and we all march on, and we all hold hands and work together. And we say, what have you got? How many contacts do you have? Here's what we have. Let's go for it. You get the ones on base. We'll do the ones here, if there are any. Sometimes there aren't any. So that's how. So we will work with anyone. And the military will keep it within their confines, if it's in their confines, like the ship. But if you have someone who is out in the community or staying out in the community, then we'll get involved if they need us. And we like to be involved anyway, so we said we want to be there. So I hope that answered your question. Are you awake?
I was trying to figure out if that answered my question.
Would you quit playing solitaire when I am speaking? Busted. You're laughing.
Yeah.
Yeah. There you go.
So what was can you just take us to yesterday, because we
wait, so no, you guys aren't doing the contact tracing. The military is handling it on their own, and then reporting the information to public health.
Actually, no, we're working with them on this one because this isn't a ship.
And they're out. They came out of the base, right?
Yeah, if they're out in the community, we offer our help, and we always get involved anyway. If it's out here, we tend to stand back, like on the TRs. They said we got this, no problem, But we're always there. But on this one, yes, we're working with them, and they send us information, and we all work together on contacts because they know if somebody had a civilian contact at the base or a civilian contact outside, and we pick up and run on that end. But everyone holds hand and we all get through it. We don't care who brings what to the island. We'll work with anyone to take care of it. If you bring it in on a plane, we're on it. You bring it in with the military, we're on it. You bring it in with a ship, we're there. It's just, that's what we do. And although we have done this all along, you all didn't see us until COVID. We're front and center now, and we're like, gosh, we have to curl our hair every day. We just have to do this. I'm just kidding. I don't.
So can you take us, Doc, just to yesterday, because it kind of seems like it was rapidly evolving. We had got a hold of your director, Linda, and what she had said was we're running into a meeting on this right now. So
Right. And that's exactly, it's all sort of new. It looks like, according to the date that I saw in the papers, they came here on May 25. So, yeah, it's all been within the last, 16 to 18 days that this has come up.
What's the... Go ahead.
No, that's okay.
What's the protocol for the military and these airmen? Are they supposed to be tested before they leave the base, or what's the deal with that?
That we don't know. We don't know. See, some of them coming in, I've been told by some of them that we weren't even involved with. They were quarantined or tested before they even got here. And now I don't know about this particular group, but the military does their own thing, and they don't really divulge that. I've never really posed that question. We just take the ball and run with it. But we don't know. These guys may have been quarantined wherever they were and tested wherever they were, because after the TR, everyone is on guard. You can imagine. It's that really sent a message to the military that they're vulnerable as well. So I'm sure they've taken whatever precautions they could before they got here. But this fancy little germ does funny little things, because if you look at it, you have someone who likely had no symptoms on May 25th, and we're all looking at the 14-day window.
Yeah.
And CDC recommends 14 days. But what we saw in March, I was reading that it's the bell curve. You've got some outliers. Some come in at less than 14. Some, they said, were even coming in at like 28 days. They had a case in China. And so it may be, the testing isn't that exclusive where you can know, on this date he was infected. All you know is you got a yes. A guy had symptoms and he's got a yes. Now, we could say, well, maybe it's an old positive. He was sick in March and it's just frat crumbs, as Chris calls it. But I don't think so in this case. I think in this case, because the paper said that, and I'm going to go by the paper. Let's assume it's true. 6 additional service members had close contact and were also confirmed positive. Well, I have to think that this is an index case. The first guy had to have been acutely with COVID, because to infect 6 others, that's not going to happen if it's like old news and fragments, because you're not known to be infectious at that point. So, but this is a guy, he's one of those outliers. Here we are, almost 20 days after whatever, and maybe paralleled to or in tandem with a quarantine wherever he came, and maybe a negative test. We don't know those things. Right. But even if you just take him face value, he landed on the 25th and shot out positive, how many days later. And it could be, and he may be within the window because if he develops symptoms, I think they said on June 11th.
Mm-hmm.
Okay.
That's about 17 days.
17 days. Okay. It could be that we do know that you're sort of infected for a few days before you get symptoms. So let's back that up. He might be within the window, actually, because that would be about 17 days. And if he actually had an exposure 4 days earlier than that, and I don't know where, or if he's just a late bloomer. That's where the tests don't tell. We don't get those. We'd love to get that history. We would love it.
Is there any? So you don't know where he came from or where these service members are deployed from?
I had seen in one article that they said they came from Tennessee. I don't know if that's the truth because it came from either the Guam Post. I was looking to see where that came from. One of the online, because it didn't come from our group. I haven't gotten all the details from our group yet. But somebody online said that posted that it was a Tennessee group that came.
Yeah, I know we tried to ask the Air Force, but they wouldn't provide information. I think, what is it, operational security or something like that.
Right.
Some military mumbo jumbo.
Mm-hmm.
Well, the Tennessee thing was something I got offline, so take that with a grain of salt. That didn't come from any official meeting. Because I haven't gotten anything from the. We're already collaborating with them, and I haven't gotten anything out of that except just the numbers, and we're beginning our contact investigation as we do with any infection.
Right, and Doc, are you guys looking at the hotel where these airmen are staying? Are you doing any contact tracing with the staff there? And are we worried about any type of exposure that may have happened?
We don't worry about it. We do it anyway. I can't even tell you the cases in TB. They're like, I was only at the house for 10 minutes one time 3 months ago. I don't care. We check you anyway. If you were there, if you were on the radar and you were on a camera, you get checked. It's just safer than sorry. Mm-hmm. And we've got the testing capability, so we do it. And we will. I think the entire unit is on quote unquote lockdown. They're a little more stringent than we are. For example, there's isolation and quarantine. What's the big difference? When we isolate, you're on what the military would call a lockdown because you're already a proven case. Quarantine is people were scratching their head going, we're watching you, but it's a little more lax than isolation where you're a confirmed case. They, as I understand, put the whole team on lockdown, so they treat them like they're all positive. So it's safer than sorry. The military can do that. If we tried to do that in Guam just to the community, we would have a mutiny. But the military can do it because they're paying them. Mm-hmm.
So where are they in isolation then? At the reef?
I don't know because again online I saw that at the reef, and then on the paper today it said, let's see. One of these articles said that they were. Yeah, here we go. All service members assigned to the unit were rapidly placed in isolation and were relocated to Anderson Air Force Base. So it depends on which online article you want to believe.
Well, no, we reported that. I just didn't know if that was the 7 that were rapidly placed in isolation, or we're talking about all of them.
They said the whole unit's on lockdown. I did hear that.
Doc,
I did hear that.
Are you guys going to do any testing of the staff at the reef or any kind of effort like that?
That's part of our contact investigation. With any infection, TB, whatever it is, if you're around them in a little perimeter, we start testing that perimeter, and if there are any positives, we move to the next ring. And people a little more remote, like I didn't even see the guy, we check those. We keep going outward until we don't have any positives. And often it's just the inner ring. The ones that were in close contact, if at all.
Good morning, Doc. Let me just cut in here. We're KUAM FM Agotni Guam. Good morning to our viewers on KUAM TV 11. Thanks for jumping on. It's the KUAM News Takeover of Guam's favorite, containing COVID, and it's all proudly brought to you by Calvo Enterprises, Ambrose Inc., ITN Coast 360, and the Bank of Guam. On the line right now, we have the medical director for the Department of Public Health and Social Services, Dr. Janna Manglona, and we're discussing 7 new COVID-19 cases, and these 7 cases were from airmen who recently rotated into Guam. They were stationed or staying at the Guam Reef Hotel. They've since been moved onto Anderson Air Force Base, according to the doc. Where were we?
No, I'm just so one of the service members first showed symptoms June 12th and tested by Naval Hospital produced a positive result on the next day, which would be June 12th. Right?
13, yeah.
So that's how many days? A week ago?
The article in today's paper said June 11th. He
Right,
was
June 11th.
showing symptoms and was immediately tested and produced a positive on June 12th.
Right.
Now,
so that's how many days?
That may be the day. That may be the date that they got it. Well, they notify us and we start working on it. Then, and I think he was included in our report. As soon as we found out that first one was included, and I think we added 2 yesterday.
Mm-hmm.
And another thing that's interesting too.
But were people and staff at the reef notified about this positive result on the 12th?
I can say this. That's our protocol.
Mm-hmm.
So I would have to assume, let's assume everyone followed protocol, and I can bet they did. Everyone that needs to be aware is aware.
But when were you guys
would they have to be quarantined? Like home quarantine, the staff?
If anybody is
reef?
in direct, there's a little formula of time and distance. So if anybody came in close contact, whoever it is, even taxi drivers or whatever, I'm just saying anybody would have to be evaluated if they are in contact with an active case. That's just being safe. Mm-hmm. And it's inconvenient, but that's just what we have to do. And then another thing too, notice this, according to the paper, and I really don't doubt the paper, this looks spot on.
No, I think what you're reading is just what everybody got, including KUAM. It's the press release.
But you have 6 people that may have not been symptomatic and were positive, and that's why when we're doing our screenings out in the villages, that's why now we're saying doesn't matter if you have symptoms, if testing is free and open, no symptoms are needed to qualify, because we can test more people if they come in asymptomatic and say, hey, I just want checked. And is it old or new? We don't know, but yeah, I'm telling you this, if you come out with no symptoms and you even say I was sick 2 months ago, you're going to get, you'll get treated as if you're a new case, because it's the safest way to do it, because we can't say, well, it's probably old, you're right. But we go ahead and we tuck you in for at least 14 days to make sure you get through it.
I wanted to switch subjects on something else, and this is the situation with the stranded Guam residents that are in the Philippines. And so we spoke with one of them and did an interview, and they may be coming back on Friday on a flight from the Philippines. But because it's a hot spot, would they have to be quarantined when they come back in a government facility for 14 days?
Yes, there are several hot spots identified, and we're looking at all the places that are on, rocking and rolling with COVID. Of course, you can imagine we've got 2 options. Bring someone in from a hot spot where the cases are still increasing and just say, break bread, be merry, have a nice time. Or we can say, let's watch it for 14 days to protect you and to protect us, and then we'll get you back home. And that's for now, today, 8 o'clock in the morning, that's the stance we're taking on hotspot areas. Will that relax? I think in the next few weeks, we're going to try to relax even more, but we have to do it safely. We literally have to take a few baby steps, check our tests, check our people, and we keep looking behind us going, how we're doing. As we plow that trail through the jungle, you go 10 feet and look back going, everybody okay? And that's what we're going to have to do. And I can't plug in exactly what that means, but I can tell you that's the approach we're going to take as best possible. Is trickle a little bit and then make sure there's no hit. Trickle a little bit more. You can't just open up, willy-nilly and let's open up the floodgates, because we don't know what to expect then. So not just Philippines, and Philippines may change. If they're not a hot spot, that won't happen. They'll quarantine at home. Quarantine will be for everybody. Everybody gets quarantined.
What if you're a returning local resident from the Philippines and you have the negative approved test?
No, that you can't. We don't even look at the test today. We don't even look at the test, and we're talking about doing that for tourism later. But that's not here and now. We don't care about the test because honestly, Chris, I could test you right now, and you're on like day 3, and it's negative, and it doesn't mean much because tomorrow you can be positive. So everyone goes to quarantine. I want to be real clear about that. Today, 8 o'clock, everyone goes to quarantine. Where that depends. You can go home and you will be monitored at home, or you can go to the facility if you're coming in from one of the identified hotspot countries, and there's several of those.
So you're on the physicians advisory group, right?
I am.
Have you guys met this week? Can you provide any updates?
We meet at least 3 times a week, and then we have another subgroup from that. We've got one for education and one for tourism. So yes, we have a meeting Tuesdays and Thursdays, and sometimes Saturdays, Sundays, more as needed. Friday afternoons, we meet frequently.
What did you guys talk about Tuesday? Anything new?
Tuesday.
What's today? Thursday?
Oh, okay. Tuesday is the big focus right now is how to safely open and protect everybody.
I see.
Because there is such a push, like everyone's feeling it. Let's move on, and you go, okay, how? That's where all the clamoring starts. What about this? What about that? Right. Is it fair to this group? The not arguments. It's wonderful dialogue that goes on in that group, and it goes on for hours because we're all going like, okay, we want to open. Can we open totally? No, we can't. Okay, how do we open partially and with fairness to everybody? So, and it's hard because you're always going to miss someone. When we open up and we go, okay, these people can open. Then someone comes along and says, I'm a sole proprietor. I never leave my home. I do woodworking. Why isn't I'm included? And you miss those. It's the bell curve again. We're going to have some outliers. I remember during 911, I had a Palestinian physician friend, and he called me from the airport. He goes, this is ridiculous. I'm 30 years old, Palestinian. They're letting me go through the airport, and they're tearing up the teddy bear on a 4-year-old right behind me, looking for something in the teddy bear. He goes, I don't get this. We always miss somebody. It's just the way it is. I mean, there's, it's just not black and white. But our main,
Can we go back to the DOD 7 positives? Is public health informed when deployed personnel are allowed restricted movement to and from the base? If not, why? And shouldn't you be?
They are. Yeah. If they're on the base, then no, they monitor it. If they're off the base, they generally have their own people monitoring their movements on if they're outside the base, just like with the TR when they were in the hotels. The military monitored that.
So you guys are satisfied with the timeliness and the manner with which you were informed of these cases from the military?
We are at the mercy of it, and they are too. We have same-day turnaround. They often don't. There's like a 2 to 3 day lag, and sometimes too, and what we don't see, like I can tell you if I have a case like on the Abbott, and by the way, our Abbott is still doing great. GMH, I'm just diverting here. GMH, however many samples they've run, we've rechecked on PCR testing at our lab, still 100% synchronized. So that's great. So we haven't run into all that. But we don't know if they do a test and then confirm it on another machine. So we see the initial test date, but we don't know what's happened then. But when they finally declare it a positive, then they notify us. And it might be 2 or 3 days. But they don't have the luxury of what we've got because they don't use our lab. They use their own. So some go to Korea, some go to San Diego, and there's a bit of a lag there. And if it comes in after our hours and after, it'll get added. The ones that we don't add the TR, that was an inside job with the military. But the ones like these, we do add these. If they come out in our community, we definitely add these.
We have a question from one of our online viewers. They're asking, will you still be quarantined if you came from the mainland or anywhere else, especially if they came for a family?
Everyone will be quarantined. 100% of the people today at 8 o'clock will be quarantined. The question is where. If you're from a hotspot area, and for example, if we identify New York City as a hotspot area, you'll be quarantined at what we call the QFAC, the quarantine facility, the government facility. If you are from a non-hotspot area, you will go to your home for quarantine, and you will be monitored.
And tests at this point, you don't. It doesn't matter if you have a test or not, right?
Nope.
Yeah.
Because those just don't mean
Right.
anything.
Right.
Now, the positive, and we're talking about having people test before they come here as tourists, because if it's negative, it doesn't mean much. We got that. But if it's positive, you won't be allowed to board. So we can weed those out right off the bat. So there is some value to testing, and with positive. With negative, yes or no. You know, it just. At least you're on a plane with a bunch of people who, if we put that through, you'll be on the plane with a lot of people who are tested negative that day or 2 days before or whatever the metric is. But yes, if you come right now, I don't think there are any identified hot spots in
From
the
the
U.S.
mainland?
that are on. Yeah, I don't think so.
I don't think I saw any.
Yeah, I don't think so. So for them, yes, they'll be quarantined if that's the question. Where? Home. If it's suitable,
right.
unless they, sorry to interrupt, if it's suitable. If we go home and they have, it's a one-room house, bedroom, bathroom, kitchen, and 7 bedrooms, and it's all one room, of course, you know, you're not going to quarantine in a setting like that. There is no such setting. But you can request to be in the government facility if you want to protect family members or whatever.
During your physicians advisory group meeting on Tuesday, was there any discussion about concerns from daycare, childcare facilities about the occupancy rate or the guidelines set forth by public health?
Yes, actually, they were telling us, again, we can say this will work and we put that out, and then the people show up and go, it won't work, and let me tell you why. And so they've met with us a couple of times to guide us, and so we're trying to work with the educational subgroup to modify that, because they had some really good points, and I think there was a little bit of a misfire, because okay, when you say, okay, you can reopen at 25%, well, what if 25% of the people there are all staff? Then where are the students? And they're like, can we have like 25% of I can't remember exactly the numbers, but they pointed out to us it can't include the staff, or you've got to include the staff when you do the numbers. And so a lot of those little things, because we don't run daycares, and so if somebody has an issue, we bring them in and say, sit down, tell us what's going on, because we're here to help, and we all got to work together and get through this, and help guide us. I mean, it's not there. We look at everyone as being so helpful when they come in with their information, and we're like, oh, okay, that's a good point, because we're all plowing through this together, and everyone's on the front line. It's not just us. We're trying to speak for people. So if we're not speaking properly, or if there's something that needs clarified, we bring you in and say, okay, now put us on the right page. So yes, there was.
All right.
Doc, I know you guys are about 45 minutes away from starting your outreach testing in Tamuini. Can we just wrap with that info, and then we'll let you go, because we got Daphne from Rev and Tax coming on.
I will need about another half an hour.
Oh my gosh, I love you.
Yeah.
It's always a pleasure.
It's mutual. Totally. I get excited when I see the little text coming through. Okay, so let's see. We've got Tamuini. Tamuini was June 18th. St. Anthony. That's today, noon. Okay, it was June 18th. June 17th was Santa Rita. We did that one. So today at noon's the next one. Anyone who wants to come, please come. And I don't care if you have symptoms. Please just show up and do your nasal swab and move on. We want your snot. Get the message out. And it's not kidding. Then June 23rd, noon, GPD, police, where is Coban parking lot? It says it's next to the Barragata Community Center. Okay, that's the next one, June 23rd. June 24th, you'll find us noon at Daniel Heights Mayor's office. And then Thursday the 25th, noon, parking lot between St. Francis Church and St. Francis School. So hopefully one of those locations will be convenient for anyone who's listening who wants to come. Bring your family, friends, anyone, no symptoms needed, just show up.
Okay.
All right,
Thanks,
there you go.
Doc.
20 more minutes.
Okay, wash your hands, Doc.
Be safe.
All right,
I'm
bye.
going to comment on that.
Dr. Janna Manglona, the medical director for public health. I like that. We want your snot. Or they run that through the marketing team.
There you go.
All right. We got your snot.
We want your snot.
Yeah, we want your snot. All right. And we're going to take a real quick short break, and we're coming back with Reverend Tax Director Daphne Shimon.